Good morning everyone, I am Izzy Ikula from BSN 3B. Today I will be discussing leukopenia, followed by my partner's presentation on neutropenia. So our blood has four main components, the red blood cells, white blood cells, platelets, and plasma. Inside our bones, there are small but productive factories. These factories are called bone marrow, and some of the products that they make are called white blood cells or the leukocytes, which is the more formal name that literally translates into white cells. Every day, our bodies produce about 100 billion white blood cells or leukocytes. Leukocytes help defend our bodies against intruders like viruses and bacteria that may cause infections. This is an easy term to recall if you remember that leuko refers to white or in this white cells, and penia refers to deficiency. So the leukopenia is a condition where a person has a fewer white blood cells in their bloodstream. Leukopenia is an umbrella term that refers to a reduction in any of the white blood cell types, and a white blood cell count below 4,000 cells per microliter of blood is considered low. True normal ranges vary based on age and sex. So, according to the Leukemia and Lymphoma Society, a healthy white blood cell count is 5,000 to 10,000 white cells per microliter of blood for males and children, and 4,500 to 11,000 white cells per microliter for females. So, white blood cells form in the bone marrow and are critical for the immune system. A person with too few leukocytes is more prone to infections and diseases. Types of leukocytes. But before we go into too much detail about this disorder, it will help us to understand a little more about leukocytes themselves. There are 5 types of leukocytes. They can be easily recalled by using the mnemonic Never Late Mama 8 veins, which stands for neutrophils, lymphocytes, monocytes, eosinophils, and basophils. While a decrease in any type of white blood cell can contribute to leukopenia, the low initial concentrations of monocytes, eosinophils, and basophils mean the reduction doesn't significantly affect the overall white blood cell count. So therefore, when analyzing leukopenia, we primarily really focus on lymphocytes and neutrophils, as their decrease directly impact the total white blood cell count and the overall immune function. Types of leukopenia. There are 5 kinds of leukopenia. The neutrophils, lymphocytes, basophils, monocytes, and eosinophils. Each one corresponds to the type of white blood cell that is affected. A person has 5 types of white blood cells. Each type helps protect the body from a different kind of infection. So the neutrophils percentage of total white blood cells in the body is 55 to 70%, and then the lymphocytes is 20 to 40% percentage, and basophils is 0.5 to 1%, and the monocytes is 2 to 8%, and eosinophils is 1 to 4%. So, a 2019 article notes that leukopenia typically occurs due to a low neutrophil count. So, when a person has low neutrophil levels, healthcare professionals refer to it as a neutropenia. When leukopenia involves low lymphocyte levels, it is called lymphocytopenia. So much for that. So now the pathophysiology of leukopenia. So it starts with the precipitating factors include exposure to radiation and certain chemicals. It can damage bone marrow, interfering with white blood cell production. And person with leukemia. Certain types of leukemia can lead to a decrease in normal white blood cell production. And also HIV virus. HIV infection can suppress the immune system, leading to leukopenia. The non-precipitating factors, the genetic predisposition. Some individuals may have a genetic predisposition to developing leukopenia, and age, and also the underlying medical conditions, such as autoimmune disorders, malnutrition, and certain infections. So, leukopenia, low white blood cells. This can affect endosomatic mutations in DNA, which causes to activate oncogene or may deactivate tumor suppressor genes. This can cause malignant transformation of lymphoid stem cells and results in the production of abnormal or non-functional white blood cells, and can cause uncontrolled proliferation of lymphoblasts in the bone marrow. The uncontrolled proliferation of lymphoblasts replace normal marrow elements and further reducing the production of healthy white blood cells, and overall decreased production of normal blood cells leads to leukopenia and increasing the risk of infections. So the signs and symptoms for the leukopenia um, are the fever and chills, sweating, toothache, sore throat, mouth ulcers that are difficult to heal, tiredness, flu-like symptoms, and rash. So this compromised immune system leaves individuals vulnerable to infections, potentially resulting in complications like pneumonia, sepsis, meningitis, endocarditis, and osteomyelitis. Okay, the pneumonia is a lung infection that can be severe in individuals with leukopenia, and sepsis is a life-threatening condition caused by a severe infection in the bloodstream. And meningitis is an infection of the membrane surrounding the brain and spinal cord, and the endocarditis is an infection of the inner lining of the heart, and the osteomyelitis is an infection of the bone. So, treatment focus on addressing the underlying cause and managing infections, highlighting the importance of early diagnosis and proactive management and preventing consequences. So, the treatments for leukopenia um, is treating underlying infection. This is essential to restore the body's ability to fight off future infections, and then discontinuing or adjusting medications that can cause leukopenia as a side effect can help improve white blood cell counts. And third is growth factors like granulocyte colony stimulating factor or GCSF stimulate the bone marrow to produce more white blood cells, boosting the immune system and reducing infection risk. 4 is the intravenous immunoglobulin or the IVIG. A concentrated solution of antibodies helps boost the immune system in people with leukopenia, preventing or treating infections. Lastly is the stem cell transplants. Replace damaged bone marrow with healthy donor cells, a treatment option for severe cases of leukopenia affecting bone marrow function. And for the diagnosis and laboratory test. For first is the complete blood count. This is the initial test to identify leukopenia by revealing a low white blood cell count. And the next is the bone marrow biopsy. This test helps determine the cause of leukopenia by examining the bone marrow's ability to produce white blood cells. And the blood cultures. Cultures are crucial to rule out or identify infections, which can be a common complication of leukopenia due to the weakened immune system. And then next is the serological test. This test can help identify specific infections or autoimmune disorders that might be contributing to leukopenia. And the genetic testing. Genetic testing is sometimes used to identify inherited conditions that can cause leukopenia, such as Cashman syndrome or severe congenital neutropenia. For the management, the following home treatments and behaviors may help a person with leukopenia improve their condition and reduce the risk of infection. These are eating a healthy diet, getting plenty of rest, avoiding cuts, scrapes, and damage to the skin, and practicing good hygiene to avoid germs. And also important is maintaining good health. So next is neutropenia. My partner will be discussed about it.
Good morning, sir. And I'm Erica Mansumer, and I will be discussing neutropenia. Neutropenia is having lower normal levels of neutrophils in your blood. Um, Neutropenia involves having lower than normal levels of neutrophils, a type of white blood cells in your blood, and especially common among people receiving cancer's treatment like chemotherapy. And neutrophils help fight infections. And if you have a neutropenia, it's important to take extra precautions to avoid germs make that make you sick. And so for additional, so how does neutrophils affects our body? So very depending on your neutrophil count with mild neutropenia, you may not experience any symptoms, but you may learn you have neutropenia may increase your risk of infections. So next, we'll come to the pathophysiology. So pathophysiology, the first is chemotherapy. Uh, chemotherapy eliminates beneficial bacterial species from gut microbiota. So this called chemotherapy disrupts the balance of beneficial bacteria in the gut microbiome. So this allows pathogenic bacteria to colonize and grow. So second is dwelling catheters inserted to deliver chemotherapy. So catheters often used to deliver chemotherapy enable bacteria on the skin to invade tissues. So next is chemotherapy injures gastrointestinal mucosa. So chemotherapy damage the lining of the gastrointestinal tract, weakening the mucosal barrier and increasing vulnerability, vulnerability, vulnerability to infections. So for welcome to chemotherapy destroy circulating neutrophils. So chemotherapy destroys circulating neutrophils, and this can reduce the number of neutrophils on type of white blood cell and essential for fighting infections. So this leaves the body more vulnerable to bacterial and fungal pathogens. For impairment of bone marrow stem cells, chemotherapy impairs bone marrow stem cells, damaged stem cells in the bone marrow, which are responsible for producing blood cells, and this further limits the body's ability to replenish neutrophils and other immune cells, and compounding the rest of infection and delay recovery. So, nagkakanya siya new microbiota composition allows for growth and colonizing bacteria, and this can disrupt the gut microbiota, creating a new environment that supports the growth of colonizing bacteria, and skin colonizing bacteria access tissues through catheters. Um, so skin-dwelling bacteria can invade tissues by traveling along the surface of indwelling catheters. For broken mucosal barrier increases susceptibility to infections. So this can damage to the mucosal lining caused by chemotherapy, increase susceptibility to infections by allowing bacteria to breach the protective layers. So um, and the kaya ano siya, bacteria penetrate tissue barriers, and this bacteria eventually penetrate tissues barriers, facilitating the progression of systematic infections. And for acquired plastic anemia, autoreactive T cells destroy bone marrow stem cells. In this condition, autoreactive T cells attack and destroy bone marrow stem cells. This destruction impairs the production of neutrophils, contributing to the neutropenia. So welcome to congenital mutations and L ELA2 gen encodes neutrophil elastase. Mutations in the ELA2 gen, which encodes neutrophil elastase, result in increased apoptosis, program cell death of neutrophils. So this premature death of neutrophils leads to their decreased level in the bloodstream. So the administration of cytotoxic chemotherapy for cancer treatment and acquired aplastic anemia and also congenital mutations in ALA2 gen encodes neutrophil elastase. These are the three precipitating factors of neutropenia. Nagkaya na siya neutropenia, absolute neutrophil count 0.5. Welcome to production of neutrophils. Neutropenia absolute neutrophil count of ENC and 0.5 as TNC cells. For so may ano siya immune cells engulfment of microbes, and production of inflammatory mediators, and then this nag so nag-circulate na siya neutrophils glands, the innate immune response. And kaya ano siya dormant viral infection, siya activate cytomega, galavirus, herpes simplex virus, and just susceptibility to common bacterial infections. And kaya ano siya pathogens, so the blood, so nagsulod na ang blood sa tissues na mo nagkaya on cause of systemic infections, and nagkaya ano siya positive blood bacterial cultures and fever of temperature of so nagkaya na siya positive blood bacterial cultures and fever of temperature 38.3 and sustained of temperature of 38 for 1 hour, and nag nag kaya na siya immune system months of excessive inflammatory response that damage tissues and organs na nag-result na siya sa sepsis. So we have signs and symptoms. For signs and symptoms, we have fever, fatigue and sore throat, swollen lymph nodes and ulcers in your mouth or around your anus, and pain, swelling, and rash at an infection site, diarrhea, and burning with urination or other urinary symptoms, urgency frequency. For treatments, we have antibiotics, corticosteroids, granulocyte colony stimulating factors, and lastly, we have the prognosis of neutropenia and leukopenia. So it's good, but in small case it may lead to a life-threatening infections. So threatening white blood cells disorder may involve posing medications or treatments, and they may be problematic if the underlying conditions is serious, such as cancer. But the doctors will help a person work around the condition, and a doctor will regularly check a person's white blood cell count if they have a condition known to cause the disorder. And getting regular blood tests helps the disorder to be identified early and treated before it leads to life-threatening infections or other complications. And that will be all, sir. And thank you.